also be sharing the slides from today's session with you guys. Everybody who's in attendance, you should be getting your daily conference emails, which have like all the resources from the day before, links to videos and stuff like that. So you will get today's session that way. We will be doing presentations and then about 10 to 15 minutes at the very end for questions. So you should see a chat box. If you will, go ahead and open that as we move through presentations. You can send in questions, comments, and everything, and we'll go through most of it at the end. Let me think what else. If you guys will, please just stay on mute. I think that we have you guys muted on this end, but mute yourselves and then instead use the chat box. And I think that's pretty much it. I'll go ahead and turn it over to the speakers for today. I'm seeing already feedback from our audience. I'm going to jump off and do technical stuff, but I'll see you guys at the very end for our questions and answer session.
Okay, thank you, Jasmine. I'll go ahead and kick it off. Good afternoon from the West Coast. And thanks for the introduction, Jasmine. I appreciate that. And David for monitoring the chat. We appreciate your help on this. It's a privilege to be with you here today to talk about employment and training programs in partnership with Peter or PJ from the VA. As mentioned, I'm Tanya Moss. I'm the director of DOL Vets in Oregon. I am a proud Army veteran of 7 years. I was stationed at Fort Bragg, North Carolina. I was a paratrooper, and my job in the military was psychological operations. I always like to tell folks that I used to be 6 foot tall until I jumped out of airplanes, and now I'm only 5'3". So that was a great military experience. I joined Vets when I transitioned out of the military and have worked in the veterans employment space for over 20 years now. I want to first say thank you to all of you for working with our nation's veterans in the past, and especially during this past year throughout the pandemic, overcoming employment challenges and helping to reduce veteran homelessness. For all of you who have served, I also want to say I appreciate your service to this country. As indicated in the opening ceremonies today, if you took part in that, the Principal Deputy Assistant Secretary for Vets talked about the Vets mission. So I just wanted to reiterate that. Our mission as Veterans Employment and Training Service is to enable veterans to reach their full potential. And so today it's going to be really exciting to talk about employment and training opportunities for veterans that are funded by the U.S. Department of Labor. Okay, next slide. Okay, today I'm going to talk about 3 main areas that relate to veterans employment and training. We'll talk about priority of service for veterans and covered persons who access the America's Job Centers throughout the nation. We'll also talk about 2 other DOL Vets programs, the Jobs for Veterans State Grant and the Homeless Veteran Reintegration Program grants. Throughout the presentation, I'm going to try to not use acronyms. But as you can see from this slide, I'm already using acronyms. So I'm really going to try my hardest not to use them, but nothing's guaranteed. So I would say on this slide, try to memorize. Priority of service is POS. JVSG is Jobs for Veterans State Grant, and HVRP is Homeless Veterans Reintegration Program. Those are our 3 topics. Also, I embedded web links into the presentation. So when you go back and download the presentation, you can bookmark those so you don't have to try to write them down to get all the acronyms and websites for your note taking today. Those will be available in the PowerPoint presentation. Okay, next slide. Thank you. Okay, so we're going to start off in talking about priority of service at the America's Job Centers, or AJCs. So that's the acronym. AJC is America's Job Center. So first, priority of service has been an integral part of the federal guidelines for almost 20 years. That guidance mandates that states that receive federal DOL employment and training funding must provide priority of service to veterans and covered persons, and that's broadly known as eligible spouses, and applies to all of the America's Job Centers throughout the nation. As you heard in the opening ceremonies as well, the state workforce agencies are the America's Job Centers. They all have their own names, but they're all part of the Department of Labor's workforce delivery system. So for example, in Oregon, the AJCs, the America's Job Centers, are called WorkSource Oregon offices, and in Tennessee, they're called Tennessee Career Centers. So be sure and look for the different names for the AJCs. And I know this slide has a lot of information, but I included it so you can take a look at it later. But first I want to define veteran and covered persons. So the definition of a veteran, and it seems like we all have different definitions, but for priority of service purposes, it includes two criteria. It includes 1 day of active military service in military, naval, or air service, and discharge under conditions other than dishonorable, okay? And the simplified definition of covered persons is a spouse of a veteran who died of a service-connected disability, spouse of a veteran who is listed for a total of 90 days or more missing in action, spouse of a veteran who has a total disability resulting from service-connected disability. So veterans and covered persons have priority of service in all of the America's Job Centers throughout the nation. So I wanted to cover that first. So priority of service, it basically gives veterans and covered persons the right to receive access to employment and training services ahead of other non-covered job seekers. So it permits veterans and covered persons to access services or resources instead of or before non-covered persons, if there is a limited resource. As you notice, I did quote the term eligible. In instances of priority service, a veteran or covered person has to meet eligibility for employment and training opportunities. So for example, if a workforce office has a training voucher for truck driving school, and there's a requirement for the applicant to have a valid driver's license, and the veteran does not have a valid driver's license, then he or she would not have priority over that covered person. So it's important to remember that they have to be eligible for that training opportunity first in order to be placed in front of another individual. There are approximately 22 DOL programs that are covered by priority of service. And some of those you might already be aware of, and you heard about one of them this morning, but some of them include the Wagner-Pizer state grants. Those are the other workforce staff that work in the employment offices. The adult and dislocated worker youth programs, senior community service employment programs, or CSAP, and Job Corps. Those are just a few of them that might be pretty well known. During the opening ceremonies, you also heard about the SNAP program. That's the Supplemental Nutrition Program, and you heard from our speaker about how important that program was to him as he transitioned and was working through the experience of homelessness. So I just want to mention that in order to find out more information about SNAP and the training and education program, please contact your local office to gain more information, and they're going to be the main source for information getting veterans registered for that program. So when you refer veterans and eligible spouses to the America's Job Center, please let them know they have priority service and make sure that they ask about it just in case they are not asked. Okay, next slide. Okay, so in this slide, we're going to talk about what to expect. So if you refer veteran clients or customers that you work with to the local workforce office or AJC, here's what to expect at that point of entry when they walk in the door. We encourage staff at the point of entry, to ask all job seekers, did you serve in the armed forces, or are you the spouse of a veteran? We strongly encourage a question like this instead of a question like, are you a veteran? Because sometimes individuals that served in the military might not self-identify as a veteran, and therefore we strongly encourage staff to ask, did you serve in the armed forces? If for some reason that question is not asked, we encourage you and to veterans to ensure that they self-identify and say, I served in the military, I'm a veteran of the military, and that spurs additional questions to determine eligibility for priority of service, okay? So if veterans are not already registered with the automated job search system, they'll be asked to register with the state, whatever state system they have. This is a mandatory step as part of DOL requirements to capture job seeker information. So they will be required to register. At that point of entry, veterans and covered persons will also be what we call triaged to determine if they meet eligibility to receive individual individualized career services by a disabled veteran outreach program staff. And we're going to talk about that acronym is Devop. And we're going to talk about that when we get into the Jobs for Veterans State Grant. So right now, some of the states are still closed to in-person visits, but employment and training services are still provided virtually. And in some cases, they are in person. Sometimes they're on limited basis. So please check with your local WorkSource office to determine if they're open, if they're accepting in person, or if they're doing virtual assistance to job seekers. So it's real critical to check that before you refer one of your customers or clients to the WorkSource offices. So a couple of examples of employment and training services. We've got workshops that are held at the WorkSource offices. We have career counseling, job exploration. We also have priority referrals to job and employment training services over non-vets, like we talked about with priority of service. There are also recommendations for training. So you can sit down and talk with a staff member about employment training services that are available to better your career or better your job. And their staff also help in tailoring skills and abilities to meet the local job market. A couple of other services that are provided. They've got resume preparation and critique services that are provided, information on training and job programs, labor market information, and job development with companies that are looking to hire veterans, as well as information about community resources and support. One thing here in Oregon is veterans are referred to take the National Career Readiness Certification, that's NCRC, test at the state workforce offices. And that is a really good opportunity to have something on your resume that shows that you met certain skills in the certification process. So NCRC is something you might want to take a look at for veterans that are needing some type of training. So staff at the WorkSource offices also work with employers. They do hiring events, they coordinate networking events to have veterans meet with employers. They also have special recruitment opportunities that are available. So those are some things to take a look at and getting on lists to make sure that you're on those lists for job fairs that are coming up in your local area. Recently out here on the West Coast, we've been seeing quite a few drive-through job fairs, parking lot job fairs. And so I think nowadays we are into that arena where some areas of the nation still that we're thinking outside the box and trying to get employers connected with veterans and making sure they're aware that there are jobs out there and it's a great time to get employed. So on the final bullet there on that slide, I just wanted to make mention that some states hold job opportunities or job listings for veterans before the general public sees them. So meaning veterans would hear about those jobs before others, but there's no federal requirement for states to hold those job orders for veterans to ensure the priority of service. The link at the bottom of the page, that'll take you to the One Stop Career Services page. There you can find, you can type in your zip code and you can find your local WorkSource office. Okay, next slide. Okay, so now we're going to talk about the Jobs for Veterans State Grant employment services that are provided to veterans in every state. So within the JVSG grant, we have 3 funded positions. First, we have the Disabled Veteran Outreach Program. We talked a little bit about it earlier. Those are basically specialists that are professionally trained to provide exclusive services to meet employment training needs of veterans and eligible persons. So they're actively involved in outreach, and they also provide case management services to those that are most in need or those veterans that have the greatest barriers to employment. And we're going to talk a little bit more about that in the next slide. We also have the local veteran employment representative. Those are staff who are professionally trained to conduct outreach to the business community. They engage in advocacy efforts with hiring officials to increase employment opportunities for veterans, and they also encourage the hiring of disabled veterans in the workforce. And last but not least, we have the consolidated position. This is fairly new to our agency, but these staff serve as both a DVOP and a leaver. So they get the best of both worlds, like we like to say. They get to offer case management to veterans, and then they get to pick up the phone and call an employer that that they know is looking for a veteran to hire. So I'll add, throughout the nation, the America's Job Centers have JVSG staff assigned, but not in all offices. So for example, in Oregon, we have 46 AJC offices throughout the state. And of those 46, we have 18 of them house a DVOP, a leaver, or a JVSG. So in some states like California, they may have 5 or 7 of our Jobs for Veterans state grant staff working in one office. So just keep that in mind when referring veterans to your local employment office. Excuse me. Just keep that in mind. Because you may be looking at just priority of service for those veterans you refer, or they may be able to work one-on-one with our JVSG staff. Okay, next slide. Okay, so we're gonna dive a little bit deeper into DVOP. I'm looking good on time here. DVOP specialists are those folks are actively involved in outreach efforts to increase program awareness for veterans that come into the workforce, as well as providing case management services and that customized one-on-one employment service for those veterans. At that triage point of entry, staff will refer eligible veterans to the DVOP staff to receive services. Some of the referrals that the DVOP staff will make for those veterans include housing, training, connection to job openings, and other types of referrals. So to be, excuse me, to be eligible to work with a DVOP, the veteran has to have what we call a significant barrier to employment. Just real quickly, a barrier to employment as far as DOL is concerned includes being a disabled or special disabled veteran, homeless, recently separated, currently incarcerated or has been incarcerated in the past 12 months, low income, or lacks a high school education, so diploma or equivalent. So if a veteran has one of those, at least one of those barriers, they can work one-on-one with the DVOP staff. The DVOP staff have a direct connection to all of the federally funded workforce investment opportunities, the training programs that are available. So let's say a veteran was an 88 Mike or a truck driver in the military, and perhaps there's a truck driving training voucher that's available in that workforce office. One thing that you want to be aware of is that the veteran has to meet eligibility in order to beat out another person for that training. So the DVOP staff are very well trained in helping veterans maneuver those training opportunities and utilize those training opportunities to help their career. Okay. All right, next slide, please. So we're going to talk about the leaver staff. Those are staff that we have that specifically work with employers and offer business employment services. They conduct outreach, they host workshops, and they just basically engage in advocacy efforts with hiring officials to increase employment opportunities for veterans. So they do this either one-on-one with employers, or they actually go out as a team and learn about business practices, learn about what the employer's needs are, and bring those back to the office and try to connect those those employers with veterans that are job ready and looking for opportunities. So, so we have an example just recently. A leaver here in Oregon was working with an employer. It was a microchip processing company. This employer said, I need 90 people today. That leaver provided, got to know the information about what the job entailed, connected with a DVOP that had a veteran that he was actually actively case managing and had the skills that in the microchip industry and was currently unemployed. So the leaver connected that employer with that DVOPS veteran that he was case managing. They pooled their resources and got that veteran hired immediately by the microchip company. So that's an example of a collaboration that happens behind the scenes for our veterans. Consolidated position, again, best of both worlds. They get to do both case management, outreach, and contact employers for those veterans that they're working with. Okay, next slide. Okay, almost ready for you, PJ. Just a few more slides. So I'm going to talk real quickly about HVRP. As you know, or may know, HVRP, Homeless Veteran Reintegration Program grants, are awarded competitively nationwide. So new HVRP awards come out every July 1st. Sometimes you may have a grant that continues in your area, and sometimes there may be a brand new grantee. So that's just kind of something to be aware of. They are competitive grants. Currently in Oregon, we have 5 grants, and in some states, there are over 30 grants. So you'll see in one of the upcoming slides, I've got a picture of where all of our HVRP grants are located in the nation. So when referring veterans to HVRP, just keep in mind that to be eligible for HVRP, the veteran must be experiencing homelessness or at risk of homelessness. And the at risk is kind of a long definition. We don't have time to go into it. So my suggestion to you is, if you or your veteran client, if you're concerned about a veteran's housing situation, the best thing to do is connect with your HVRP grantee program staff and allow the HVRP staff to triage their eligibility to see if they're a good fit for their program. Okay. HVRP has 2 core objectives: provide services to assist reintegrating homeless veterans or veterans experiencing homelessness into employment, and to stimulate the development of service delivery systems that address complex problems that veterans experiencing homelessness suffer from. They accomplish these 2 objectives in a variety of core services they provide. They also use a case management approach, just like the Devops staff do. They just operate a little bit differently, and most times our HVRP grantees are really dealing with very, very significant barriers to overcome, so that we can get those veterans experiencing homelessness back into the workplace. The staff for HVRP create a myriad of partnerships in the community. Most times they already have those partnerships before they're awarded grants, and they just look to make sure that they have the resources and community resources available for those homeless veterans. Once employed, HVRP program staff ensure veterans stay employed. They follow those veterans for a year after they are placed into employment to ensure that they have that they're okay, that they're still doing okay in employment, and if there are any needs or career opportunities where they might want to better their job opportunities, then they work with them in that sense. Okay. Okay, next slide. So elements of HVRP, veteran, number 1, the vet's going to be assessed for eligibility and for their job readiness. Okay, job readiness is critical because HVRP is an employment and training program. Staff use a case management approach to address the most challenging barriers. Most of the time that is housing first, but they also work towards job readiness and removing barriers and getting them placed, as I mentioned earlier. The staff also create employment and training plans that help them to focus on the skills that they need to enter back into the labor market. The other thing that happens that is super important is the motivational speech, and encouraging our veterans to continue job search, to work on your skills, and to help them understand the ins and outs of job search. I think we've all heard that sometimes 1 in 10 applications is going to get you some feedback, and so teaching folks that it's okay to hear 9 no's, because that 1 yes, that is where you've got an opportunity to excel. With HVRP, there's also a requirement for co-enrollment. So that's where we see our Devops staff and our HVRP staff working together to jointly assist that veteran. Let's see. And I would just say, just to kind of tie in both of these programs, This is what we call the wraparound approach to serving our veterans who experience homelessness. So our programs, we really encourage them to work together. Both programs have phenomenal skills, abilities, their staff that are bringing to the table to just wrap around that veteran to help them get employed and change lives. Okay, next slide. So this is the map on where you can find HVRPs in your area. You can't see the link very good. It came out in blue because it's hyperlinked. But when you get the PowerPoint presentation, click on the link and you'll go to this map. But this gives you a visual of the yellow dots of where we have HVRP throughout the nation. As I said earlier, there's a few states that do not have HVRP. So make sure that you look into that in your local area. Okay, next slide. Next slide. Thank you. Here's my contact information, and you can reach out to me. Definitely welcome, any questions or anything like that. I will most likely make sure that you're connected to the resources in your area or to the DOL vet staff in your local area, but feel free to reach out. You can contact me there or contact me on LinkedIn. Next slide. And this slide is going to be good for later on. These are embedded links to, I guess they're kind of like my top, top 6 resources that you can use when you're sitting down working with a veteran. You've got the Department of Labor site, the veterans.gov site, which I just want to make sure everyone knows that's going to be migrating over to DOL. So if you click on the link and it says redirects you to the DOL vet site, that is in the works. The other thing that I will mention on ONET and My Next Move, these are great resources. Take a look at those, click on them, play around with it, because there are some really good options in there to translate military skills to civilian language, as well as doing career exploration. So really want you to take a look at those and just bookmark those. So when you're working with your veterans, and let's just take a look at ONET online and see what kind of jobs are out there. The last option there is the Career One-Stop offices. That's where you're going to find your AJC or America's Job Centers offices in your local area. You can type in your zip code and it'll pull up all the offices in your area. Okay. And with that, I just want to say thank you very much for your time. That concludes my presentation, and I will turn it over to my co-presenter, PJ. Thank you.
Tanya, thank you so much. Great presentation.
Thank you.
Hopefully at the end of my presentation, you'll add my link as one of your top 6 favorites.
I will.
Right. Hey everybody, my name is PJ Steigers. I'm a licensed clinical social worker and certified rehab counselor. I'm the section chief for vocational rehabilitation services at the VA Greater Los Angeles healthcare system. Next slide, please. Today's Employment 101 discussion is focused on providing an overview of VHA, Veterans Healthcare Administration employment programs. However, I wanted to touch on the importance of employment services within the homeless services, and also provide some resources to help guide you all moving forward. All right, next slide. Okay, if there is any takeaway from today's discussion, I'm hoping that would be recognizing work as a priority. There are stereotypes from a variety of sources, including providers and clinicians who provide care to homeless experienced individuals, that they can't work. But the literature speaks to the importance of employment in the lives of homeless individuals and shows how they can be assisted in job seeking. Some reports suggest it may be effective and worthwhile to offer employment at the earliest stages of engagement to help people who are homeless develop trust, motivation, and hope. Practitioners have historically focused on providing people with access to safe and affordable housing and supportive services, usually addressing employment later in the continuum. But in fact, employment should be offered as early as possible. And the research maintains that facilitating employment is an unrecognized and unutilized practice for preventing and ending homelessness. Next slide, please. Employment is a key element in helping our veterans transition permanently out of homelessness or to avoid it altogether by increasing access to permanent housing and improving housing stability. Employment provides an improved quality of life, increased self-confidence and independence, opportunities for socialization, and a decreased reliance on institutional care. Employment services play a key role in a recovery-oriented practice because it helps clients articulate and realize their goals in the areas of work, school, and in their career. Employment is about beginning to get out of poverty and achieving a standard of living above entitlements. And it also has enormous psychological meaning. The self-definition of a client with psychiatric disabilities changes from a person with disabilities to a person with abilities. And the social roles defined by employment open up an entirely new world of socialization and possibilities for social inclusion. The transformation from a client to an employee is not only a change of employment status, but is also a change of self-definition and of social status. And much of the past two slides come straight out of the Housing First model, and also the article from Shaheen and Rio, Recognizing Work as a Priority. Okay, all right, moving forward. All right, next slide. So now that I'm off my soapbox, again, I am a clinician, and I just want you all, if there's any takeaway from today's training, it would be just to recognize the importance of work and making that a priority in the services that you provide. But now transitioning to the overview, which I've been asked to speak about today, of our VHA employment services. So first off, the homeless veteran community employment services. As a part of efforts to end homelessness among veterans, around fiscal year 2014, the VA enhanced employment services for veterans through HVCES, which is staffed by vocational development specialists who function as community employment coordinators and employment specialists. The CEC are funded at each VA medical center, and programs have funded employment specialists at a limited number of VAMCs, VA medical centers, based on local needs within the HUD-VASH programs. HVCES staff ensure a range of employment services are accessible to veterans who've experienced homelessness. These veterans may need individualized support to overcome barriers preventing them from returning to work. And the staff are tasked with collaborating with community, state, and federal partners outside of the VA to provide training and support services to veterans that are not available within the VA. They're also tasked with engaging employers to develop new job opportunities and ensuring ongoing support services are available to homeless veterans once they return to work. And in the next few slides here, I'm going to dive into further the role of the CEC and the employment specialist. All right, next slide, please. Okay, so the HUD-VASH employment specialist, the process to access these services has no lengthy assessments, no transitional employment or training period. The only question needed to begin is, do you want a job? And if the answer is yes, the client and the HUD-VASH employment specialist begin to plan the steps needed to achieve that goal. The HUD-VASH employment specialist teaches, guides, and coaches clients as they write resumes, search for jobs, prepare for interviews, find transportation to and from work, undergo training, maybe assistance with adjusting to a work schedule, accepting new responsibilities, etc. And the employment specialist can help identify career paths and meaningful jobs, negotiate accommodations with employers, and really serve as a liaison between the clients and their employers. They encourage and assist clients look for employment that aligns with personal interest and goals. And perhaps the most importantly, the HUD-VASH employment specialist can help clients redefine themselves as working, contributing members of society. And that really is what recovery is all about. And again, much of this is taken from the Housing First model, which references the IPS supported employment model. And this is how we operate in Los Angeles regarding employment services with the HUD-VASH. And this is how the employment specialist within HUD-VASH looks nationally. All right, next slide, please. All right, so now on to the community employment coordinator. The VA created, the HVCES program to improve employment outcomes for veterans who have experienced homelessness, and deployed more than 150 vocational development specialists who serve as the community employment coordinators at most VA medical centers across the country. These CECs are part of the VHA homeless program teams and are a bridge to community employment resources and employers ready to hire veterans exiting homelessness. The CEC really is the employment champion within the VHA homeless programs, and works closely with the other VHA employment programs, including the VHA Voc Rehab Compensated Work Therapy Program. And this is all to identify employment resources available to serve homeless and at-risk veterans, including the chronically homeless vets. Okay, and I think, yeah, the next slide here, I'm going to dive into sort of those VHA VR employment services. So the Veterans Health Administration Vocational Rehabilitation Services are a component of the Psychosocial Rehabilitation and Recovery Service. And this is under the Office of Mental Health and Suicide Prevention, different from the HVCES initiative and programs which I mentioned. This is under the Homeless Program Office. VHA VR, VHA Voc Rehab is appropriate for all veterans eligible for VA healthcare, living with mental illness or physical impairment with barriers to employment, who want to secure and maintain meaningful community-based employment. And VHA VR is to be provided to veterans with mental illness, substance use disorders, homelessness, criminal justice involvement, physical disabilities, and other disabilities that contribute to their occupational dysfunction. All right, next slide, please. Okay, so this slide and the next slide provides an overview of the VHA VR program components. VHA VR believes that supporting all veterans return to work is of great value to our nation. These services are also critical suicide prevention strategies. They're recovery oriented and focused on each veteran's strengths, abilities, needs, and preferences. And in all of the VHA VR program components, employment plans are individualized and based on veterans' goals, skills, and abilities, and services are outcome oriented, resulting in meaningful community-based competitive employment. And so this slide and next shows the different components within VHA VR underneath the compensated work therapy umbrella. And so looks like we have a little bit of time here. I can go through some of these bullets individually. The first and probably most known VHA VR program is the Transitional Work, or the TW program. And this is a transitional therapeutic work program that are in medical centers and in the community. And they enable our participants to gain work experience and work hardening while they're on these therapeutic work assignments. The next bullet here is supported employment. This looks a lot like the HVRP model that I mentioned earlier with the employment specialist. This is the evidence-based IPS model for supported employment. This focuses for veterans with SMI, and veterans who are engaged in VHA mental health services are sent to VHA Voc Rehab through their medical provider, their mental health provider, to seek these services. The Community-Based Employment Services, or CBES, is a program that provides a range of job support services. It's for veterans with mental health and physical disabilities who require support, but not necessarily have the SMI diagnosis as indicated in the SE model above. Okay, next slide. These are the last three program components for VHA Voc Rehab. Supported education. It's helping our veterans throughout their educational goals. And so it's providing those individualized supports as they're engaged in education and training programs, and follow along supports as they pursue those goals. The same thing with supported self-employment. Veterans who have goals of becoming self-employed or starting their own business. We have voc rehab specialists that can support veterans towards those goals. And then lastly, vocational assistance. In Los Angeles, we see this mostly within our domiciliary, but this is assessment and guidance or other related services that are offered to groups of individuals or individuals themselves, to help them sort of have a better understanding of realizing their skills and the resources are around them, and sort of helping them navigate towards what their employment goals may be. And of course, the ongoing follow-up that goes along with that. All right, the last slide. Here is the resources and contacts slide here. That's me. I'm PJ Steigers. That is my direct email and my direct cell phone. If you have any questions, you can reach out to me directly. Like Tanya mentioned earlier, I'll be happy to help navigate any resources that you have out there, or just be a sense of support. And then there are the 3 components to VA. I recognize the last one on here, VBA. I recognize I did not touch on that in this presentation. I was asked to talk about the VHA side of the things, but the Veterans Benefits Administration does offer the VRNE program. You can learn more about that by accessing the VBA website. And then the 2 other components that I did talk under the VHA umbrella, the Homeless Veteran and Community Employment Services, as well as the VHA Voc Rehab. Both of those websites can be accessed through these links here. And of course, again, if there's anything that I can do to help support you towards engaging with your veterans around employment, I'm all in. Please don't hesitate to give me a call or send me an email. That concludes my presentation. It looks like we're right on target for the 15-minute Q&A session.
Yes. All right, you guys. Thank you both. That was a lot of information. And you guys both provided tons of resources. So that's always awesome. We like links. Yeah, so just so everybody who's in attendance knows, if you did not hear in the very beginning, you guys will be getting recordings of today's sessions as well as the slides, so you'll be able to go back and reference the links. I thought of a couple of questions that come up, some with interacting with veterans on our hotline, and then also the various programs and stuff. And I'll wait for the audience. We had a couple of comments, but not so many questions. So if you guys have any questions you thought of, please go ahead and send them in. I guess one of the questions that come to mind, are veterans able to enter these programs multiple times, or are they able to like exit and re-enter? Is there a limit to how many times they can enter the programs? I know you guys covered several, but
yeah, I'll take that first, Peter, and then I'll turn over to you. Yes, so on the state workforce delivery system, a veteran can enroll, register, find work. Maybe they exit the program because they found work, and a year later they lose their job. They absolutely can come back in. With our JVSG program, our Devops services, those staff can also work with veterans on and off, depending on what the employment needs are. So that's absolutely available. On the HVRP side, a little bit different. So you'll want to, the service providers will want to touch base with our HVRP staff. There are opportunities if a veteran enrolls in HVRP, gets a job, is exited from the program, and there are some opportunities to re-enroll. But again, there will be a full assessment done to make sure that that veteran is ready to go back to work. I'll turn it over to Peter.
Yeah, thanks. As I mentioned, this is a recovery-oriented vocational model. And so veterans are always welcome to come back to our programs, be assessed for their needs, take a look at what their new needs may be. And so we understand that we will get folks that are re-referred to our programs, and we're happy to assist them towards their vocational goals when they're ready to work towards those goals.
Great, okay. I'm wondering, and this is a little bit unrelated to like the operation of the individual programs, but I'm wondering if there's any thought that goes into these programs being used in conjunction with the housing programs. It always seems like we get veterans who are enrolled in the housing programs, and it's like, oh wow, I know of this great thing that would work so great as a complement to the housing program you're in, but they've never heard of it. Like the program operators have never heard of it. So I'm wondering if there's any thought that goes into connecting these employment programs with the housing programs and the operators of those, and then veterans who might be participating in those.
Yeah, I'll start. Yeah, so that's a huge focus of us, and what we're doing with under the VHA side, particularly the community employment coordinators. They're the champion for employment services within the homeless programs, and so each of the VA medical centers have a community employment coordinator that is embedded with the homeless services provided at the VA. And so they're truly the champion there. And so recognizing where there may be gaps in services, perhaps in some of the continuum, and trying to fill those gaps with employment is a huge focus of what we do. Additionally, HUD-VASH specifically, the Housing First model calls for the multidisciplinary treatment team. And so employment absolutely should be part of that. And so on the VHA side of things, there are sites throughout the country who do have employment specialists embedded in HUD-VASH. In Los Angeles, we definitely have that. And so again, if there's gaps and there are not staffing available for HUD-VASH, the community employment coordinator would be there to identify the gap and either find a VA resource to fill it, or partner with folks such as Department of Labor, DOL vets programs to fill that gap.
And that's a great answer, Peter. And I will add that part of our DOL vets programs, a huge component is outreach. Outreach not only to veterans to let them know that our programs exist, but also to the employer community and the veteran service provider community that our programs exist, the staff are available to help. And as part of my discussion was that wraparound services to those veterans, letting them know that we don't operate in silos. We understand that each program operates a little differently, provides different services. Sometimes those services can be brought together for that wraparound service delivery and get those veterans back into the labor market. So as well as for employers, outreach to let them know that that we have veterans. We have veterans that are ready to go to work. We have veterans that have some barriers to employment, but we work with them to overcome those and barriers, and then continue to follow up to make sure that they're okay once they get placed into employment. So part of our programs also are linkages with those community service providers like the VA, like SSVF, like VHA. So those, can we do a better job? Yes, it's always of the utmost to reach out to make sure that the local community is aware of the programs that are available to veterans.
Great. Okay. And then just for somebody who's a little bit further removed from the employment programs, and most of our work, at least when we work directly with veterans, is connecting them to housing resources. But it seems almost like the employment programs are targeted to specific veterans, and the culmination, I guess, would be employment. So veterans wouldn't necessarily use employment programs to bridge to other employment or training programs. Is that a correct understanding? Or of any of the programs you guys mentioned today, do they operate kind of as a bridge to other employment or training programs? Does that make sense? Would veterans ever use multiple of the programs, or is it kind of qualify them for the program in question or whatever, and once they do, enroll them in it, and then the culmination is employment?
On the DOL vet side, I would say that our programs operate together to make sure that they're meeting the veterans' needs, meeting the veteran where they are, and bridging those gaps, because there's this thing called underemployment that we've talked about, we've heard about. So it is important that you know, that one job, if veteran enrolls in our programs, gets a job, that doesn't necessarily mean that that we're done. You know, we want to make sure that we address underemployment of veterans. We want to make sure that that job that they got might not be the end all be all. Maybe that's the stepping stone in the career field, or maybe it's just the job that gets them back into the labor market, and then they're going to look at that career field that they want to pursue. So I would say that there's always a continuous movement forward in employment, especially when we're dealing with underemployment. If I understood the question correctly.
Yeah, and I think this was sort of part of my soapbox early on, right? If there's a takeaway from today's training, it would be to recognize employment and work as a priority. I think, you know, practitioners have historically focused on providing people with access to housing, and not necessarily addressing employment until later on in the continuum. And so, again, if there's any takeaway from today, it would be to recognize work as a priority, to identify and know what resources are available, and really to take a look at employment perhaps through a different lens. Employment doesn't necessarily have to mean, you know, 8 to 5 desk job, 40 hours a week. For many of our veterans, that is neither a goal of theirs or sort of a reality. And so employment can mean part-time. Employment can mean seasonal. Employment can mean only during special events, you know, and it's sort of reshaping the way that we as providers take a look at employment, and offering employment opportunities and resources to our veterans as early as possible within the continuum of services.
Mm-hmm. Yeah, that's a very good point, Peter. I'll just add as the cliff note to that, you know, it's incumbent upon us to ensure that our thoughts of a job and employment, if that, you know, we meet the veteran where they are, and their thoughts and ideas of what they want to do. That's our goal, is to help them get to their career goal. So that's absolutely critical as well, that we meet them where they are. What do they see themselves doing? If it's self-employment, let's figure out the steps that we need to get to self-employment. It doesn't have to be that 9 to 5, like Peter said. So that's why it's so important to work with with the veterans that you refer to our programs, because there's not a one size fits all. And I think Peter said that very well, that we really need to take a look at what their needs are, what they want to do. And they may have filler jobs, but those filler jobs are okay to, if that gets them moving in the right direction of the career field that they see themselves in.
Gotcha. Makes sense. And we'll do this as the final question. So an audience member is wondering how hard it's been to help veterans get any expungement that they might need from their background to help with employment, and any tips.
Yeah, I mean, in Los Angeles, we are so fortunate to have so many resources available with regards to justice-involved veterans. And so, you know, we lean on our community partners to help us with those legal issues. I don't think there's a one size fits all. Some may be easier than others to sort of answer the question, but I think what's important is knowing what resources are available in your community, and sort of making partnerships with those resources, and again, connecting your veterans to those agencies. But again, there are a lot of resources out there I know of in Los Angeles, and if again, I'm available. If you want to reach out to me directly, I can help you navigate in your own local area if needed.
The other thing that I'll add on the expungement, during many of our stand down events, those communities provide what's called veterans court or veteran legal assistance. And so those are opportunities also to work with the legal departments in your state to determine if there's a better way to take care of parking tickets, if there's a better way to take care of minor violations. So Veterans Court is something that you might want to research in your area if that's available, or take a look at setting up some type of agreement where the legal system can take a look at those veterans with those issues and see if there's a better way to help expunge or clear some of those minor violations.
Great, okay. And just because I know we do have that resource on our website, the list of stand downs, I encourage you guys to check it out if you've not heard of that resource before. But I think that's going to take us out, you guys. Thank you again for your presentations and all the information you guys have shared. Thank you to the audience for being in attendance, and look out for our follow-up email with links and the recording from today. But yeah, thank you guys again.
Thanks,
Everybody.
Bye-bye.
We'll see you guys later this week.
Have a great rest of the conference. Bye-bye.
Bye.
Thanks. Bye.